Good afternoon, good evening, everyone. I'd like to welcome you to the March 11th Managing Survivorship Educational Series. And what we're going to talk about today is about sexual health matters when it comes to prostate cancer. Now, we have a speaker, and this is Miss Mary Hughes, and she's an advanced practice registered nurse, and from my home state of Texas, and where I went to medical school. So there's a couple of things I wanted to say too. I want to again thank you for. I will. Okay. I want to thank you for attending, and I want to thank all of our sponsors, and our sponsors are Amgen, Bayer, the Dana-Farber Cancer Institute, Alexis, Johnson & Johnson, Merck, Novartis, and Pfizer. So before we go any further, we're just going to do a simple question, a pre-presentation poll. And we just want you to, there's no right answer, okay? What are you looking to get out of here? We wanted to get an idea of what's relevant to you. And so is that low desire, libido, erection problems, orgasm changes, dry orgasm, partner communication, intimacy, ADT side effects, mood changes, and you're just really not sure. You just want some basic information because we want to make sure that you get to walk away with something, and hopefully all these topics we'll cover these either in a quick presentation and then a fireside chat. So what I like to do, and let's kind of go over some housekeeping things. I want everybody to know this is educational program. This is not for personal medical advice. I just want to be clear. If you have any personal medical questions, you should go back to your care team. That's important. All right. If you do have questions, then I would like you to put them in the Q&A question box. 11% of the folks online had questions about low desire, libido, 39% erection problems, nothing about dry orgasms, partner communication about 14%, ADT side effects and mood changes 7%, and really not sure and really looking for getting the basics. So that gives us something to do. Over time, we hope to be able to answer some of these questions out there. What I like to do is tell you what I'm going to tell you, and then tell you what I told you. So I'm just going to give you a quick overview of some key points I want you to think about. So everything here is open for discussion. I don't want you to be afraid. This is a safe place because where are you going to get these answers, your questions answered? But here at the Managing Survivorship program. So the topic of the discussion this evening, is sexual health matters. Now, what we like to do is the first thing is this. This is a prostate cancer fact. Most patients do not fully regain their pre-treatment sexual function, but pleasure is still possible. Now, I want you to recognize this is a very honest statement. It's not supposed to be discouraging. It's really to be freeing. It's supposed to make room for you to think about adapting your body, regaining your dignity, and really hope. Another point, and this is very interesting, why sexual health matters in survivorship. And that's extremely important because what we're looking for is that survival is your first milestone when we talk about prostate cancer journey. But connection, intimacy, quality of life are also important. And living is so important. That's that next one. So sexual health is not a side issue. It's part of your identity, connection, joy, and quality of life. I want to clearly bring that up again. Next, we want to reframe this misconception. And this misconception is sex is bigger than intercourse. Sex is bigger than intercourse. And sexuality is bigger than performance. If intercourse is difficult right now, that doesn't mean intimacy is gone. If function has changed, that does not mean sexuality has disappeared. So I'll say it again. If function has changed, that does not mean sexuality has disappeared. This is very important. Now, next, common sexual changes after the treatment with ADT. Now, if we look at, after surgery, erection problems often happen right away. After radiation, changes may happen more gradually. Hormone therapy often affects desire, energy, mood, and erections. So I want you to be aware of that. So if you have those questions, or some of you may have started programs where you're taking an ADT or you're taking an oral like Orgovyx, and you may be experiencing some of these problems, this is where you can answer that question.
Can I add, what is ADT?
Androgen deprivation therapy. Now, mental health. Now, everyone in this room, I can ask you, has anybody talked to you about mental health? They talk to you about the procedure itself, the treatment options, and side effects. But mental health, there's side effects associated with mental health. There's anxiety, there's sadness, grief, body image concerns, a fear from disappointing someone can all show up in the bedroom before any physical things happen. So, next. And let's not forget, you're not in this by yourself. Matter of fact, prostate cancer is known to be a couple's disease because it impacts not only you, but it impacts your caregiver, your partner. And this is something that you have to recognize, that your partner may be balancing and may be experiencing things that she or he may never have a chance to discuss. So partners and caregivers are often trying to help while carrying their own grief, confusion, and exhaustion. And then we will go over briefly, and Mary will touch upon this, is the treatment options overview, pills, pumps, injections, and implants. And the question here is this: what should a man be able to do? What happens? What helps this person feel more connected, more functional, confident in themselves? Restoring intimacy. Let's start with having the ability, start with permission, being patient, planning, and being honest, and having honest communication. Sometimes the first goal is not intercourse. Sometimes the first goal is simply feeling close again. So, takeaways: your body may be different. Your need for closeness, pleasure, and dignity is still real and still deserves care. Now, I'd like to bring on our guest speaker, Miss Mary Hughes. Mary?
Hello, thank you. I'm very glad to be here and speak to your group.
How's the weather down there in Texas? How's the weather down there?
The weather, actually, it rained about an hour ago and now it's sunny. And it was in the 80s yesterday, and today's the high 70s.
Okay, we're up here. We did make it up to 60 in some areas.
Oh,
All right.
wow. Yeah, all of our trees are blooming, so spring is really here.
Okay, that's good. So, Mary, before we get to treatment options, What do you wish every patient heard before treatment started?
That there will be sexual changes after your treatment. Regardless of the type of treatment, something about your sexuality will be changed after treatment.
Mhm. Now, I wanted everybody to let that soak in. So you're not going to be 100% if you were ever 100% in the first place.
Oh, and that's what I was thinking.
So if some points that you wanted to show us in the slides, or we can jump into the fireside chat, however you want to do it.
Oh, I thought it was good. I don't have any slides. I thought we were going to
Okay.
do all
Then we can
slides.
jump into the fireside chat. That's good. So now that's very important, because what Mary's recognizing is this. This isn't a didactic. This is not a lecture. We want you to feel comfortable. And we want to guide you through this journey that a lot of people don't talk about. Okay. So can you separate 3 ideas people often mix together: sexuality, intimacy, and intercourse?
Yes, often people use those words, we haven't been intimate in years, or we haven't had intercourse in years. As you know, intimacy you have with your best friend. It's a matter of trust. You trust the friend trusts you. That's in your relationship. And all of you know that if you don't have trust in a relationship, you don't have a relationship. Trust is number one. And sexuality is a combination of a lot of things. It's how you dress, what you feel about being with other people, physical affection, hugging, kissing, all of those kinds of things. What bond you had with your parents growing up. That also predicts how you're going to bond with a partner, a sexual partner. It has to do with love, not only love of somebody else, but love of yourself. And it's a very positive and respectful approach. You always want to, it doesn't matter if you're in a long-term, short-term relationship, always make sure that your partner is willing to have some type of sexual activity with you. And sexuality also has to do with activity. And as you know, intercourse can be penile vaginal, penile anal, penile oral. It has to do with the penis for sure, and some other orifice. So it's very important people have things that they do, and both partners are comfortable with that. That's the thing with getting a permission. And people will say,
So
"I've been doing this."
clarify that again. So I mentioned permission, and you mentioned permission again. So
Well, say you want to do something that y'all haven't done in the bedroom before. Say you want to try, you have a female partner, and you want to try anal sex. Well, you can't just spring it on her. You have to be prepared, and you have to ask her if this is something she's willing to do. So
Okay.
it's permission to do different things, or permission, no, I don't want to do that anymore. So that's what I mean by permission. Any activity that you do with your intimate partner, make sure you have permission to do that.
Okay.
And
Yeah. Mhm.
and sexuality has to do with touch. You may be from a family that's very affectionate and you touch each other and hug, and somebody else may be from a family that's very rigid and they don't do any of that. So if you get together, there's going to have to be a lot of compromise in what you do. And sometime when your penis doesn't work, touch is what's very, very important. Hugging, holding the person, physical affection. So I've been doing this since 1990. And when I ask, when's the last time you had any type of sexual activity? People tell me, how did it used to be before your surgery or radiation? And then the next question I ask, are you still affectionate with each other? Do you still hug and touch and kiss? And most people say yes, but some people say no. And that's one of the things that they miss, because the partner that doesn't have cancer is afraid if they hug and touch the person, they're asking for sex when they just want to be close. So that's important to realize. It's not foreplay. For most people, it is foreplay. So then they get it confused when that's not what they want it to be. They just want to be close
So intimacy is a closeness with the person that you care about
and trust.
and
Big,
trust.
big issue of trust. Yes.
Okay.
So
So
you trust that person when you're trying to perform and things aren't working, you trust them not to shame you, not to say, oh dear, we should do it this way, or this has never happened before. Oh, that's not going to help things, is it? So you trust them in your most intimate moments.
so the next question is, what would you say to a man who feels my body has changed and I don't feel like myself anymore?
Well, I would agree your body has changed. Tell me how it's changed. Has that changed how you feel about your partner? Has your partner's body changed? And has that changed how you feel about your partner? You feel different. And one of the things that we know, we can never go back. So you can't go back to having those diamond cutter erections like you used to have. So the erection scale where 0, there's no erection. 1, it's stuffable. 2 is stickable. 3 is diamond cutter. So that's like when you were a teenager. So you can't go back and regain what you've lost because your body has changed. Everybody's body changes. So now, what is important to you, and how would you like to proceed with your partner?
So how is it important to you? What about you? How does this dialogue between the partners take place? Because it's right now it appears that it's more about the way the prostate cancer patient survivor um, wants versus the needs of their partner or caregiver. Because it still doesn't feel like there's a coming together
Well,
or
sometimes,
adapting. It doesn't
yeah,
appear there's an adaptation taking place.
and it's important. And you've heard about giving I messages. So one of the I messages, I really miss the way we used to have sex. What about you? What do you miss about our times together in the bedroom, if you want to use that euphemism? And so hopefully your partner will notice that you've opened up and you revealed something very intimate. I really miss, being able to have sex the way we used to. What do you miss? And then what you don't miss.
Okay. Now, I'm thinking about let's help people understand there's a lot of things that you can do. But when someone is trying to decide where to start, how do you think about pills? What are they supposed to say? I mean, what is the patient going to say to their care team? Because a lot of people don't even think about bringing that up into the same discussion with, okay, I'm having radiation, or I'm gonna have surgery, and then, well, I don't really think about sex or this.
Often
Yes.
I find that the doctors that treat men for prostate cancer are much more open to talking about sex than women who have breast cancer. So the doctor may say just a little blurb. Well, you may notice some sexual changes and just keep moving on. And you're thinking, well, I'm trying to live. What did he say about sex? So, that it's just a little blurb. So you're
I
trying to
mean, that's
figure,
that's the point. That's the point. It is just a little blurb. Just like, oh, by the
yes.
way, don't worry about that. Let's talk about hot flashes. That's
Well,
it.
then when you've figured out you're going to live and you've lived from your treatments. So remember when you brought up about sexual changes, you're talking to your
Mhm.
provider.
Right.
What did you mean? And so that they have to, I have to answer this question. They'll probably say ED. I don't know if they'll say much about libido or orgasms, but for sure they'll mention ED.
Mhm.
So then you keep going, well, what do you mean I won't have erections? Can I use the erection I have? I don't have any erections at all now. So what can I do about those? And if you're on androgen deprivation therapy, you won't have any desire either because it's blocking your testosterone. So it's not forever. Usually you get it for 1 year or so. Every 6 months you get an injection, and it makes your penis smaller. Your testicles get very small. You may get gynecomastia, breasts. Your hair pattern may change. If you're diabetic, it's very hard to control your blood glucose if you're on ADT.
Oh, okay. Now, is it something you could do physically, like exercise or diet, that can help you better um, deal with being on androgen deprivation therapy? There was somebody in the audience who asked what ADT meant earlier. So
Yeah.
that's deprivation therapy.
Well, not much, because you think about testosterone goes all through your body. It helps make you feel manly. It helps make you be competitive. If you're a salesman, men have told me, I don't care if I sell anything. I just don't care if I win or I'm, playing games anymore. It's really not important because testosterone gives you that little edge. Now, when you get off of it, and you may have mood swings, you may feel depressed, all of those, your muscles may atrophy. But when you get off of it, then you don't want your testosterone high, but then just having a little testosterone in your body makes you feel more like your normal self, like you used to.
Mhm.
But
Okay.
knowing this in advance, then you don't feel like I've had men say, I thought I was going crazy because I would be happy and then I would be sad, even crying spells. The ADT can affect you that way.
So everybody heard that. So these are kind of topics that may be in the periphery. They don't really talk about that. You're going to have to bring that to the forefront up as part of your discussions. You're going to save my life because the treatment that I'm going to have is going to kill the cancer or slow the growth of cancer, but I want to live my quality of life. So quality of life, all these things that are important to you in life are also something that you have to think about. So then, we know that there's like the pumps and vacuums and all these devices. We're not going to talk about those as of yet, and you may comment on those a little bit later. But realistically, how do you help men stop blaming themselves when a treatment is not working the way they hoped?
Are you talking about when the cancer treatment isn't working or the treatment for sexual changes?
The sexual changes.
Okay. Well, the only way you can tell me how you use this. Tell me when you use it, what happens when say it's an injection, or it's the pump, or it's certain kinds of implants. How are you using that? So what's not working? Maybe they just don't like it. Often within a year of getting treatment and having these devices to help with erections, men aren't very compliant about using them. So, just like blaming yourself for cancer, that doesn't change it, does it? Whatever kind of cancer you have it. Whatever you did in the past that might or might not cause a cancer, it doesn't change it at all. So blaming yourself for not being able to have the erection despite using injection pills or whatever, that doesn't help it. All you can do is report it. So I'm doing this, like you said, and it's not working. Now what can I do? And there's disappointment, of course, because all of the Viagra ads and the Cialis ads, you think things are going to be wonderful. Even if you haven't had prostate cancer, not necessarily.
So that's an important point. There's the marketing that they see on the outside and what the reality is. And so you see how we have to move away from the ability to have an erection. Is the erection the most important thing in intimacy, love, connectivity with your partner or loved one? Touch and communication, right? So there's something that comes up, this whole desire, because a lot of people don't understand or still have desire, and the libido didn't drop when they were taking ADT. So there's some people out there that yeah, they may have mood swings, and you did mention that. But the erection pill, the blue pill, whatever pill, is not going to solve the problem. So how do you help men get past all this grief? Because this is a lot of grief, but no one talks about it.
It's a lot of grief. You're right. You're grieving for what you've lost, and so is your partner.
Mm-hmm.
And you have to, that's why when you talk, I really miss having sex with you. What do you miss? What do you think about it? So you could talk about what it was like. Even people who don't have prostate cancer, men, as a relationship 30, 40, 50 years, they're not going to have sex the same way they did.
Mm-hmm.
It's going to be, think about when you first got together with a partner. If you had sex that much all your life, you wouldn't last very long because you would burn out. You have sex like rabbits when you first meet. You know,
Well, we have people in the audience. I'm not going to tell you what they're saying, but I'm just going to let you. They didn't say anything about burning out rabbits, but we'll accept that on that end.
because you change, and if men that are older men that are with older women, they're postmenopausal, so you're going to have to use some kind of lubricant, moisturizers, change positions. As we get older, things don't feel good the same way they did before, and often women are they're satisfied without penile vaginal penetration. They find other ways to please each other. The penis might not be as sensitive, the glands is. The navel is a erotic zone, so are the nipples. So, not just focusing on the penis, but focusing on other body parts that still feel good.
Oh, so you're almost like saying, there's this whole concept of the whole concept of foreplay, communication and foreplay. It's just there's other areas of the body that men need to recognize are ways, and somebody got hit, but I'm not going to say, but the way you communicate or if the way you're intimate with your partner. And then even you put in the whole point is that there's intimacy with gay men. That's a whole different area because primarily your roles may switch from a giver to recipient. So,
And yeah, in order to have anal sex, the penis has to be very, very stiff, and it doesn't usually get that way with any of the ED enhancements. So the person who was the giver has to change roles and be the receiver.
now is issues, you diamond cutter, the way you described it, is that something that happens when you get an implant? Is that?
Oh yeah, yeah, you could get an implant. And that because the implant changes the shape of the penis, so it's not round anymore, it's more kind of rectangular. But yes, the implant makes it stiff enough.
But
But
again,
after
even though you
having,
get an implant, you're still going to have to communicate with, you're going to have to adapt. And adapting means communicating and being, yes, communicating with your partner and looking for different alternative or options.
and regardless of what ED enhancement you use, there has to be foreplay with the injections, with pills. It's very important with the pump. There needs to be foreplay to keep things going.
Mhm. Okay, so we're perfectly rolling into the whole issue about partners. And again, we talk about it being a couple's disease. Your partner is really often trying to help, but they don't know how to help without creating pressure on the prostate cancer patient or survivor. Mary, can you help us understand what supportive communication sounds like?
Well, one of the things, of course, you want to avoid is having anybody feel guilty. Oh, I'm so sorry, I can't have an erection, and the partner said, oh, that happens sometimes. Now you have enhancements to help you with an erection, but you don't just want to focus on the erection. Like you said you want to focus on the whole experience. You know, what some people do is they schedule sexual encounters because they're so busy. Or, I saw somebody the other day and he said, it's been a month since we had sex. I didn't even think about it. We get so busy and you schedule other things in your life. So why not schedule sex? Some people, often fatigue is a big side effect of many of your treatments. So if the morning is a good time and you have a little energy, that's the time to schedule sexual encounters. Some people choose to take the pill, they will have take the pill Saturday morning, make love and then go out to brunch because you take the pill on an empty stomach. Remember that. I don't care if it's an hour after you ate, empty stomach. So morning is a good time to take it. So work with your partner. And, I've had women say, my husband said, should I take a pill or not? Now, how romantic is that? Should I take a pill or not?
Oh,
So,
so
yeah,
I think you come back with foreplay and effective communication, and there's now you're throwing some romance in there too. So we need to go back to basics. Is that what you're trying to say?
absolutely.
Okay.
And because often, at least the people I see, it's been a dry spell for quite a while. And so, well, then, how do we start having sex again? Well, when you dated, how did you do that? You have date nights, and it's very important to have date nights. It doesn't have to cost a lot of money. Make an appointment and watch a movie on TV, and a hamburger. It doesn't have to be expensive, especially if you're going to use those pills. You need to do them. Take the pill before you have your date night. So it's like you're starting to date again. You're kissing because people don't kiss like they used to if they're not having sex. So start all that hugging and kissing, taking showers together, doing all those things you might have done before. Sleep nude together. So all the things that you used to think about and you used to do is kind of fell by the wayside, and you got into a habit. We have sex every Saturday night. And by the way, is the most popular time to have sex is Saturday night.
Saturday night?
Uh-huh.
Hmm,
So if I
interesting.
were a robber, that's when I go rob somebody is Saturday night because we're having sex.
Okay.
Be
Well,
occupied.
yeah, yeah. Well, for a period of time, I do
Yes.
understand that. So we're with these partners, right? And we know the partner and the spouse or the prostate cancer patient both are grieving, right?
But often the partner tries to protect the person and say, oh, honey, that's okay. It's not that important. But that's not what the man wants to hear. He wants to hear, yes, I miss it too. So, real, truthful communication, I miss it too. And what can I do to help you?
Okay, because it's okay. So let me just backtrack again, because we, how do you start the communication? Because everybody's grieving, partner's grieving, you know, the prostate cancer patient is grieving. Somebody has to give in and be vulnerable or begin the discussion, and the discussion's always difficult to begin. So what are you suggesting?
Well, sometimes people reminisce. Remember when we first started going out? I remember when, after we've been married several years, that we did some different stuff sexually. Remember that? Wonder if we could do that now. So sometimes reminiscing helps.
Mhm. Reminiscing, being adventurous, role playing, is that?
Are just reminiscing. Remember, what I
'Cause
tell
people,
people,
some
if
people
you knew,
they weren't very creative when they were younger. Now you're older, you have to be creative. It has to be some difference, I would suspect.
well, think about this. If you knew the last time you had sex was going to be the last time, wouldn't you make it really count? All the bells and whistles and everything that you wanted to do or tried to do, you'd want to do it then because you knew that was it. We're never having sex again.
So what you're saying is make love to your partner like it's your last time.
That's right.
There's a song out there. Lady Gaga said something. Die. Something. One of her songs.
Smile.
Die with a smile. Lady Gaga. Okay. All right. So we put that out there. Okay. So now, because we focus on the communication with the partners, I want to focus on men, prostate cancer patients who don't have a partner. Now, since they don't have a partner, are they supposed to be worried about sexuality? I mean, if you don't have anybody, you're not having sex with anybody, so why would you worry? Is that correct? Or should a person without a partner be concerned about having that discussion earlier on?
Well, number one, you know better than I know, men masturbate all the time. You get in the shower, you start washing yourself, you start washing your penis. Oh, this feels good. There you go. Didn't matter if you're married, if you have sex every day and twice on Sunday, men masturbate. That's a common practice. So
we will accept that. Okay.
so it's important to continue masturbating. Why? Because your penis is a muscle. So you get blood into it, it remembers. So erections are important whether or not you're having sex with somebody else, because this kind of is exercise.
Right.
So it helps the penis to remember, okay, penis, muscle, blood in there. And so it makes it more usable. And so that's important.
But should they have it, when should they have that? They should have discussion the same time a person who has a partner or a caregiver with their doctors, right?
Oh, absolutely. It matters not if you have a partner or not. It matters that you want to know how things are going to be going sexually in the future. And now you're a sexual being. So you're all of you, your thoughts, how you dress, all of that stuff. People shaving their pubic area, all of that has to do with their sexuality. So you're still a sexual being. Now, the hard thing is when you decide you want to start dating, how do you tell the person you're dating? How do you, first of all, even tell them you've had cancer? Or what kind of sexual? Yeah.
I have cancer, and then what? It's it. My stuff don't work.
Yeah. How do you tell them that you have sexual dysfunction? Or changes in your body? You don't like the way your body looks. It doesn't look like it used to. And when do you tell them? How much do you tell them? Do you wait till you at least had a date? I don't know. I haven't dated in decades. So do you tell the person when you go out and you're sitting there eating dinner, I just want to let you know I've had cancer? Or do you wait? Because if there's not a spark, they don't need to know that. That's too much information. But it's up to you to decide. There's no right way to do it.
There's no right way.
Yeah.
Because it's very different. It's different than having a partner who started the journey with you.
Absolutely.
You were divorced or widowed or just plain single, and then you're trying to get past having cancer, your treatment, and you want to live your best life. But then the whole fear and anxiety that a person that you're communicating with, the moment they find out you have cancer or had cancer and were treated for cancer, and that you have to disclose, because see, one would not know about erectile dysfunction. That's not something that every person knows. That takes place when you have prostate cancer treatment.
Right.
So what you're saying is it's up to them, but how do you can you help the audience understand or give them some tips, a script or something like that? It's like, how do you use this concept to?
No, because it's very personal. It's very subjective. So you may, when you meet the person and you go out for coffee or whatever, you may think, this is premature. I don't want to talk about sex with this person. Or if you feel a real connection, then you may mention, I just want to let you know, to be transparent, I've had prostate cancer. Or you can say, I've had cancer, and see how the person reacts. See if they say, well, what kind of cancer? Or see if they say, and what I bet they'll do is, oh, well, my uncle had cancer. My mother had cancer too. They may start connecting to other family members that have cancer. And they may not ask you what kind of cancer because they think it's personal.
Mhm. So, okay. Now we hit upon, prostate cancer patients, survivors with no partner, with a partner. So how do we get to a point when it's just we're past frustration and now we're in an area that we need more mental health assistance when it's affecting our mental health?
Yeah, well, and anxiety and depression occur in 20 to 75% of people with cancer, and
Mhm.
they're conditions that are treatable. You don't wake up one morning and say, I'm depressed. You need to have symptoms for at least 2 weeks, feeling hopeless, having difficulty sleeping or wanting to sleep a lot, appetite's not good, or you want to eat a lot, you don't care about doing anything. And one of the symptoms of depression is sexual disinterest. Doesn't matter if you've had cancer or not. If you have depression, that's what make men go to the doctor. They won't go to the doctor, but if they're not interested in sex, go to the doctor, checks them. You have depression.
Mhm.
So it's very important. You may feel hopeless, not look forward to anything at all. And so it's important to have that treated. Maybe you were a go getter, you were up doing and going, and this is the ADT that can cause this, and your
Mhm.
depression needs to be treated. And medications are great, but it takes 2 to 3 weeks for them to work. Therapy helps too. A combination of therapy and medication work. Now, anxiety, if you're an anxious person, you're not going to suddenly be calm because you have cancer. Now, and I tell patients, now you really have something to worry about, don't you? Oh, yeah, I'm worried about it coming back. Very often people are worried about that. So, anxiety is you have trouble relaxing, you don't sleep well, you're nervous. People that are anxious don't stay in the present. Think about it. What if? What if my cancer comes back? What if this doesn't work? Or if only I'd have gotten treatment, if only I went to the doctor. That's not the present. So those are fantasies that are very negative fantasies. What if it comes back? If only. You can't control either one of them. So stay in the present. When you wake up in the morning, today I know I don't have cancer. Or today I know my cancer is being treated. Then if you start wandering off during the day, but what about if, nope, I don't have cancer now. So it's self-talk. That's very important. Medicine can help. Therapy is very helpful. So it's a
Okay.
matter of talking to yourself and staying in the present.
Okay. Talking to yourself and staying in the present. I like that staying in the present. Enjoy today and not worry about tomorrow. Okay. So now we've had a lot of information. I want to open the floor for people here at the Dana-Farber and people online who may be interested in asking us some questions, asking Mary a question.
I
So
have a
Jerry?
question. Yes. What lifestyle changes, exercise, diet, stress reduction, etc., have helped others improve sexual health and overall well-being?
That's a good question. And as you all know, your doctors, your nutritionists, everybody will tell you everything in moderation. You know, preferably you focus on a plant-based diet, regular exercise, meditation, to help you calm yourself every night. Some people, insomnia is a big problem with people. So think about a gratitude journal every night before you go to bed. Write down what you're grateful for that day. That kind of empties your mind, and then it helps you to relax and get to sleep. And if you're physically healthy, then you will be able to perform sexually regardless if it's your fingers, your tongue, vibrator, whatever. You'll be able to do that and enjoy it, and you won't wear out because you don't have any stamina.
Another question, Jerry?
Yes. There's a question about, let me see, how can I talk openly?
Could you speak up a little bit? Yeah.
Yes, how can I talk openly with my partner about changes in intimacy after prostate cancer treatment?
So how can I talk openly to my partner about treatments,
About changes in intimacy
about
after
changes in
prostate cancer
intimacy
treatment.
relating to prostate cancer treatment? Because that is a fact. How do you talk without feeling vulnerable about this? It means we're not supposed, you suck it up and get tough. I was like, look, that's not what
So
we
let
can.
me ask you, did you talk openly about sexual issues before all of this?
Well, majority of people don't. They just
I
have,
know. I know. I'm playing the devil's advocate. All of a sudden now we're supposed to be able to talk openly about sexual issues when you didn't before. Things just happened and you were so glad it happened. So now it's a matter of, I went to this meeting and, we were talking about do those kinds of things, kind of normalize it. We were talking about how hard it is to talk about sexual issues. What do you think?
okay.
Now, if you have a partner who's verbally, can talk, they'll go, well, it is hard. Although there's some partners that go, I don't know. When you ask them, what do you think? That's really frustrating. But you can, with iMessages, I would like to find out what you miss. I think it's what you miss. That's the important thing. What you miss about our sex life.
Okay.
Then I think that's important. That gives them a chance to give their input.
So there's some questions that come up. There was one, is there a typical timeline for recovery of an erection or orgasm after surgery or radiation, or is it highly individual? I mean, I think I mentioned that before, that if it's surgery, it's going to be more upfront. Your effect is going to be earlier on. And it may, take maybe a year and a half to even get to a level that plateaus. And then with radiation, it's something that may take a longer time, but it will also affect it. So it's a case by case basis, I guess, is the best way. It's individualized. But what was interesting about what you said is if you eat right, exercise, increase, and even some doctors will have you take the pill post-operatively or
I
after
use the pump. Yeah.
the pump. Okay.
Often after surgery or radiation, they have to use a pump because your penis maintains length and girth better if you start using the pump right away.
So do you know if these treatments are covered by insurance? I think a lot of people were interested in the penile implant. Is that covered by insurance?
As far as I know, Medicare covers it.
Okay. So Medicare, if you're above 65, that's an option for you. I don't know what's going to cost, but
Well, and often men don't think about that about getting one because it involves surgery. Although it's day surgery, you go in the morning, they put the implant in, and then you're ready to go. As long as you're stable, you're ready to leave in the afternoon.
yeah, this is and thank you for answering that. This is an interesting question. And a person has two brothers, and they're in different cities, but she wants to talk about prostate cancer with them, but how does she kind of open this dialogue? How does she get it going with family members?
Oh, what questions? Well, besides announcing that, as you know, I'm being treated for prostate cancer. If there's anything you want to know, ask me.
Mhm.
Because they might not want to know a lot. They just, okay, it's on the table. It's not a secret. I have prostate cancer. I've been treated, or I am in treatment.
Mhm. Now, there's some questions on here also, Jerry, where people are asking about more detailed, we have some additional information online at Fin TV that goes into, we have a whole video about the treatment options that are available. So we'll have that posted with this when we air the video. And there's, if it's, so after prostate cancer, I don't know if you're able to answer this, but this is, again, we're maybe digging too deep, is the after prostate cancer treatment, is it normal if their orgasms feel different? Or is it
Yes.
an ejaculate?
Yeah, that's what men say. The orgasm doesn't feel as powerful. You may have dry orgasm, or you may have retrograde, where the semen go into the seminal fluid into the bladder, and the next time you void, your urine is cloudy. But it doesn't feel, at least most men say, the orgasm doesn't feel as powerful as it used to. But you still get a sense of release.
Okay. Okay. So the next question, there's a person that has pain. Having pain during erection, is that something that's normal along with their dry orgasm, or you complaints about that?
Well, sometimes men do have pain, but it's maybe, especially if you had radiation, there may be some penile strictures. And, when you have an erection, regardless of how you have it, it may be breaking those up, and that's what hurts. Also, there's something called anodyspareunia, and that's when if you're having sex anally, it hurts.
Right.
So, lubricant is very important with any kind of sex that you have.
When a person gets a penile implant, or just
With anything.
anything?
Yeah, I mean, if unless you have a woman who's still menstruating and still having estrogen, and she has doesn't have vaginal dryness or anything, but most women do of a certain age. So it's
Right.
important. Coconut oil is very good. You can use that. It's cheap. Everybody's got it.
Okay. So the next one, how long after prostate cancer surgery does sexual health get affected? Again, I think that's one of those questions that we've kind of covered a little bit before, and that it's kind of on a person-by-person basis. But generally speaking, prostate cancer, the surgery itself first affects erections more immediately than radiation, and radiation's over time.
And even proton therapy can affect erections. And sometimes men are surprised at that. They didn't
Right.
think that would affect their erections.
Okay. And there's some other questions, but I don't think we'll be able to answer. Research on the ED pills and how they work. But there will be some topics in the future that we'll have to dig down deeply into, just focusing on the erectile dysfunction pills themselves and when they should be used. I mean, one key thing that Mary said was, you need to use the pill on an empty stomach. Don't have a hamburger and fries, milkshake, and then try to throw in a pill. It's just not going to work. Jerry, do we have any additional questions? Are we good? Okay. So again, at the end of the day, we like to tell you, and then we like to test you. Okay. No, I forgot to tell you one more time.
That'd be a test.
And this time, it's not a test per se. We want to get feedback from you. We want, Jerry's gonna post some questions, and we want you to respond. We want to get feedback. We want to do better every month. So next month, we want to do better than this month. We also want feedback on what type of topics you want to have. This is a very difficult topic. You probably heard more in an hour about erections, intimacy, sexuality, and how partners feel in this hour, more so than any of your time with your doctors. And then what's interesting is this, it's not you, after you have surgery, you're not meeting with a social worker or, a cancer social worker or a cancer or sexual psychologist. You have to ask for these people. But the question is, why do you have to ask if this is directly accompanying, it directly follows treatment, especially now, since you're not going to, if you have a treatment, you're detected early, your life expectancy for early detection of prostate cancer is greater than 10 years, 98% life expectancy greater than 10 years. And even if you have a little more advanced disease, your still life expectancy is going to be in the 90s regionally. So the earlier we detect disease, the longer you can live, the slower the return of the cancer. So that's why this is important. Mary, go ahead.
And all of you will appreciate this. I've go to all different countries and talk about this, and other countries say, "Oh, of course you are from the United States. You talk about sex." I said, "No, we don't talk about sex any more than any other country." So nobody talks about this. Nobody. I don't care. Brazilian wax, Brazilian, all those little things, lifts, and everything. Nobody in any country talks about sex any more than we do, or any less than we do.
And then nobody talked about sex as much as we did tonight.
That's right. That's right. Everything you want to know about sex, but we're afraid to ask. That was a book that came out in the 60s or 70s.
No.
Before any of y'all were born, I'm sure.
No, I don't know. Some of us were barely creeping along on all four, crawling. So, Jerry, how are we with our questions?
Yes.
Okay, keep it. So, there's something I wanted to tell you, and while we're doing this is, okay, Mary, we have people online, we have people in the audience here at the Dana-Farber. Can you give them, what would you just tell them? How do you start the conversation with your care provider? I want to talk about sex? Or just, what would you suggest? What's the easiest way to kind of start the discussion?
I'll tell you, there's no easy way. And I can tell you from experience, and as big as MD Anderson is, for 35 years, I've been the person people get sent to. One person.
One person?
And I'm in psychiatry. So they come and say, I'm not crazy. I don't know why I'm seeing you. I'll ask.
Let me ask you a question.
Yeah.
Let's everybody ever, Dana-Farber Cancer Institute is it's one of the leading institutions in the world. In Texas and in the South, MD Anderson is one of those leading institutions, big institutions. And you had one of you?
Well, we're focused on making cancer history.
Well, if they can do it with you, then I guess that is history. Okay.
Well, and when they come, I'll say, and they don't know why they're here. And so I'll say, well, did you mention something about sex to the doctor? Oh, yeah. Well, what did the doctor do? He said, I'll send you to somebody, and runs out of the room. So it's hard to have a conversation when somebody leaves the room, right?
Okay. Well, I guess I guess my little script that I said, can you give me like a sentence like, I need help with the sexual side effects and intimacy? I guess that's not even going to work. I won't even have enough time to even ask that.
Well, we have an ED clinic. Round one runs our ED clinic. So men go there. They give them, if they want the injection, they have to get it there. They show them how to use a pump, whatever else. But it's a clinic, and they go. It's at MD Anderson, and they go there. But what are women to do? So I think you could just say, I'm worried about, or I'm concerned about how. You can even say my relationship has changed, or my sexual relationship has changed. Often your partner is with you when you see the doctor. And you could say, we've been wondering how we can manage the sexual changes. Well, they may run out of the room, but at least you brought it up. Often the nurses are the one that will help you with that.
Oh, okay. The nurse practitioners and the social workers do you have social workers at MD Anderson?
Oh, yeah. Yeah, we have a lot of social workers.
I'm glad you brought that up and that's why I tried to bring up the caregiver or the partner side of the story, because they're always alone in this journey. they're trying to be empathic and caring, but grief is grief and it's affecting both of them. And the loss of intimacy is grief.
And I see couples, I also see caregivers. So, cancer's an equal opportunity giver or taker away. But think about this. All of you know you're survivors and you're cancer free and you're being checked constantly. So
Mhm.
you know what your people out in the community don't know, you don't have cancer.
Okay.
That's a wonderful gift.
And okay. So Jerry, we have our polls up. And again, thank you, Mary. If you want to be online with us to kind of get some feedback, so you'll see. After this session, how strongly do you agree with the following statements? Sexual health should be discussed at the beginning of prostate cancer diagnosis visit. 72% strongly agree, 22% agreed, and 7% were neutral. Next. How clear are you on why starting sexual health conversations at diagnosis matters? Very clear, 80%. Somewhat clear, 16%. Really not clear was 4%. So we're hitting it home. Now people are feeling as if this is something I need to start earlier on in the journey. I'll say after this session, how will you do? How well do you understand how early treatment decisions can affect sexual function and intimacy? Very well, 86%. Somewhat, 14%. So we're doing good there. We're doing good today, Jerry. How confident are you that you can bring up sexual health at or before your next prostate cancer appointment? 83% said yes. 17% said somewhat, they're confident. And so again, I guess us talking about the topic and bringing it to the front for everyone, that's going to be something that you'll be able to talk to your doctor about. What is the intention of the intention after this session? What is your intention after this session? I will raise sexual health at my next visit. That's 75%. Okay. I will raise it within the next 1 to 3 months. That was 11%. I'm considering it, but not ready, 6%, and I do not plan to raise it, 8%. Okay. Okay. Did the problem allow adequate time? Did this program allow adequate time for audience Q&A? 97% said yes. 3% said no. Okay. Would you recommend this session to others? 97% said yes. 3% said somewhat. How do you rate the speaker? Okay, 94% said excellent, Mary. And
Thank you.
6% said good, but I guess they haven't been to Texas yet. So when they go down there, we can raise it, give them some barbecue or something like that. Yeah, they'll like that. Would you attend another survivorship focus session? 97% said yes, 3% said no. Well, I'm sorry, we'll have a topic. So there might be something that 3% might want to hear about. So just keep an eye. Okay. Now, how did you feel about the session's pace? Just right, 100%. That's good.
Wow.
Good. Were you satisfied with the meeting and the presentation content? 83% very satisfied, 17% satisfied. Okay. And then let's look at the breakdown. Now, this is, we had 61% prostate cancer patient or survivor, 6% spouse, 8% advocates, medical professionals, 6%, community leaders, 11%, and other 8%. Okay, so that's good. All of those numbers are good. So, all right, I want everyone to give a hand to Mary, Ursula, and in the room, okay? And what I wanted to do, and I kind of jotted down a thought, just to close, tonight was not about perfection. It was about honesty, hope, and courage to ask for help soon. Sexual health matters because you matter. Your quality of life matters, your relationship matters, your confidence matters. And whether you are a survivor, a patient, a caregiver, a partner, or single dating, or simply trying to feel like yourself again, there are people, tools, and next steps that can help you. Thank you for being with us tonight, and good night.
Thank you.